Well, I think you hit on a couple of good points. Right? There's treatment to extend your life, but then what's the quality of life look like during that time? And I think we have to consider that as we look across, if you've seen one patient, you've seen one patient, right? And now with the sophisticated screenings and testing and all the new innovative therapies coming to market, I think we can extend life, and I think we can make the quality of life much better. But of course, it's up to that individual patient on how long they're expected to live and what kind of life they want to live during that time frame.
Of course, I think the quality of life and, of course, patient preferences should play a very big role because very often they might be different from the doctors or health professionals' perspective. We had a poster in the poster session I was discussant of where it showed that for patients who enter treatment at a lower quality of life because of symptoms and problems they have due to their cancer, quality of life is the preference, not the life expectancy. Right. So they would prefer living, they don't care if they live shorter, but they put very much stress on the quality of life. And I think that quality of life and independence, even if it's not possible for somebody to return back to full pre-morbid life, is probably one of the central issues. Of course, there's another point that through your reiteration comes out. It's also the discussion of overtreatment. We know for some cancers, we recently know very well about prostatic cancer, for example, that we probably overtreat many men, and we move the treatment ages also much lower, implying that we cause a lot of very severe side effects on larger populations of men. In women, where it is more frequent, but it's not limited to women. Such a cancer recently is thyroid cancer, where not all cancers would need to be operated at all. Of course, patients, when faced with a diagnosis, will say, well, remove it. We will not run the risk of keeping the cancer inside, and then, but we see that, practices are varied. But in any case, I think that one feature of cancer is specific in view of all chronic diseases, and that's the fact that you can get rid of it. Yeah. Because all the other diagnoses, and especially severe cardiovascular disease, neurological diseases, which are sometimes obscured by these big groups, like dementia, Parkinson's, and so on, are not curable. They are treatable, manageable, but they are not curable. Once you have the diagnosis, you're done. Yeah. And although cancer treatment costs a lot of money, it's very focused in this initial phase. And of course, in other diseases, it's spread over decades, like diabetes also. Insulin and other drugs that you use are used over 30, 40 years. And similarly, if you treat hypertension or cholesterol and so on. It doesn't cost so much per unit, but it accumulates over time.
Yeah. Good point.
Okay.
Well, thank you very much for stopping by, and enjoy the rest of the Congress.